Frequent urination might not seem like a big deal at first. Maybe you just drank too much coffee or had a bit too much water. But what if it's not going away? What if it keeps happening over and over again, even when your bladder's almost empty? Here is something most people don't know. Some sexually transmitted diseases, STDs, can cause frequent urination. And if you've had unprotected sex recently, your body might be trying to tell you something important. Let's dive into what you really need to know. First things first, why would an STD make you pee more often? Well, when you get an STD like chlamydia or gonorrhea, it can lead to something called urethritis. That's when your urethra, the tube that carries urine out of your body, gets infected and inflamed. That inflammation makes you feel like you have to pee constantly, even when there's barely anything there. And it's not just annoying, it's your body's way of waving a red flag. Let's break down the STDs most likely to cause this. Chlamydia is one of the most common culprits. It often doesn't show symptoms at first, but when it does, you might notice a constant urge to urinate, burning or stinging when you pee, abnormal discharge, pain in your lower belly or pelvis. Gonorrhea acts very similarly. It infects the same areas and causes many of the same symptoms, including frequent urination, yellowish or greenish discharge, itching or irritation inside the genitals. Trichomoniasis, a lesser-known but super common STD, is caused by a parasite. It might give you that same annoying urge to pee constantly. A strong-smelling discharge, genital irritation or burning, and then there's genital herpes. Yes, herpes isn't just about blisters. If the sores are near your urethra, they can make peeing painful and give you the feeling that you need to go all the time. But here is the tricky part. Many of these infections don't start with obvious symptoms. You might not see anything, feel anything, or even think anything is wrong until your bladder starts acting up. That's why frequent urination can be such an important early warning sign. So how do you tell if it's an STD or just a UTI? The truth is, they can feel almost the same. But here is what makes STDs stand out. Discharge that's unusual in color or smell, pain during sex or ejaculation, itching inside the genitals, pain that comes and goes, or gets worse with time. If any of that sounds familiar, it's time to act. What should you do next? Start by listening to your body, then get tested. Testing is fast, private, and easier than ever, whether you go to a clinic or use an at-home test kit. If it turns out to be an STD, treatment is usually straightforward. Antibiotics for bacterial infections like chlamydia or gonorrhea, antiviral medication for herpes, and proper care to relieve symptoms quickly. And remember, your partner needs to get treated too. If they don't, the infection can bounce right back. The bottom line: frequent urination might feel like no big deal, but when it's caused by an STD, ignoring it can lead to serious complications. That includes pelvic inflammatory disease, infertility, and long-term pain. Your body is speaking. Don't brush it off. Get tested. Get treated. Protect yourself and your partner. And want more straight answers about your sexual health? Visit sexualhood.com and take control of your body with knowledge that matters.